evening and thank you for being with us. Ontario Premier Doug Ford says the province is looking at resuming surgeries and other procedures that were cancelled due to COVID-19. The first priorities will be cancer and cardiac procedures. Colin DeMello has more.
In the push to prepare for the pandemic, Ontario hospitals were instructed to shelf scheduled surgeries to create more capacity for COVID-19, affecting people like Janice Enns, who waited a year to remove a tumor in her kidney, and now she worries about the long-term damage.
I don't know if it's metastasizing. I don't know anything. I just know it hurts a lot. So I don't even know if they can save my kidney now or if they're going to take it all. I don't even know nothing until the surgery.
The province ended up canceling more than 52,000 surgeries during March and April to prepare for COVID-19.
We always knew that the potential for our hospitals to be overwhelmed was very real. So from day one, it was all hands on deck.
But the overwhelming surge did not arrive as anticipated. And today, the government released a framework for hospitals with guidelines for how to reschedule surgeries. Hospitals would need to have a stable number of COVID-19 cases, a stable supply of personal protective equipment and medication, and an adequate supply of intensive care beds. And all hospitals would need final sign-off from the province before implementing their plan for procedures.
It's going to be up to each hospital to figure out how they can proceed, what's the best way for them to proceed, what they're going to concentrate on, and that will be coordinated through their regional tables.
While cancer and cardiac surgeries will be prioritized, hospitals are also being told to first consider outpatient procedures so that patients don't have to be admitted to hospital and potentially be at risk of contracting COVID-19. Elliott says, though, the process will be fair.
We want to make sure that we can proceed on all fronts in a very measured and equitable way based on the condition of the patient, of course, and the degree of need.
But the government says it'll still be several weeks before surgeries can resume. Patients say the wait is agonizing.
It's very stressful, yeah. I try not to think about it, but then the pain will hit, and so many other things are going to come, complications from waiting.
I know it's very, very anxiety-provoking for people. If they have cancer and they're waiting to have this surgery, we want to be able to step it up as soon as we can. But there are many, many issues that come into that decision.
Still, patients say the government never should have canceled any cancer or cardiac surgeries in the first place.
One new case of COVID-19 is being reported today by the Thunder Bay District Health Unit. He's a man in his 40s from the local area who is now self-isolating after he was exposed through close contact with someone who had already contracted the virus. There are currently 77 confirmed cases in the district, 11 of which are still active. Federal Health Minister Patty Hajdu says she's been able to keep a fairly close eye on the situation here locally. The Thunder Bay Superior North MP believes collaboration between the health unit, the hospital, and municipal leaders has helped to keep the numbers manageable. And as attention begins to shift towards reopening the economy, Hajdu believes local experts should have more autonomy to make the decisions that are right for their community.
I think I'd leave it to the local leaders, right? Because the local leaders are, first of all, making the decision based on their own outbreaks, but also on their own knowledge of their capacity to deal with outbreaks. So there's two parts to that, right? Not just the disease activity, but what's the capacity to deal with a really big surge? And so I think it's both of those considerations. So listen, I will say that we all can play a part as well in keeping the disease activity low. So if you are going to go to a garden center this weekend, for example, make sure that you remember that you still need to socially distance. You need to physically distance in that garden center. You can then do your part as a citizen to keep that risk low and help your community continue to take the next tentative steps towards further services.
It is Mental Health Week across Canada, and at the Thunder Bay Regional Health Sciences Centre, a new initiative aimed at helping staff to cope with the COVID pandemic is taking center stage. Michael Mahorovich has that story.
Compassion and respect for everyone, otherwise known as the CARE Initiative, is leading the way for the Regional Health Sciences Center's Mental Health Week. With anxiety and stress higher than usual for staff members on the front lines fighting COVID-19, The new initiative is there to give them the extra support that they need.
That offers all of our staff, our professional staff, everyone that works with us, access to psychological first aid. And what that psychological first aid is, it's different than psychotherapy. It's a brief discussion. We have our psychosocial staff here that can support our staff in developing not only new coping strategies, but adapting existing coping strategies in order to adapt to some of what we're going through right now.
But the hospital isn't just focusing on their staff over the duration of their mental health week. They're also focusing on their patients and their patients' families. With visiting restrictions in place, the toll of not being able to see loved ones can weigh heavily. And for that, the hospital says there are resources available.
This situation is forcing in a great way all of us to work in different ways. So it may not be the traditional method if you need to book an appointment with a therapist. There are online resources that have been existing for a long time that are now multiplying, where you can either anonymously or with your name and with direct support access. Many of them are free. There's loads of online resources for yourself, but then also traditional ways of working and therapy are now very often working online.
Overall, McMahon says hospital staff are coping with the added stress well. The hospital is constantly checking in with all frontline workers and staff members to ensure everyone is aware of the resources available. Michael Mohorevich, TBT News.
The western part of our region hasn't seen a single new confirmed case of COVID-19 over the past 2 weeks, but officials with the Northwestern Health Unit say they're still wary of reopening that area to business as usual. To date, there have been a total of 16 cases reported by the health unit that serves areas like Kenora, Dryden, and Fort Francis, and all of those cases are considered to be resolved. Earlier this week, Premier Ford called out several unnamed health units regarding the number of tests being done. So far, the Northwestern Health Unit has conducted 2,600 tests, which is above the provincial average, according to Acting Medical Officer of Health, Ian Gemmell. He says he's cautiously optimistic that their catchment area may have dodged the first wave of COVID-19. But despite that optimism, Dr. Gemmell believes measures taken thus far to limit the virus should be maintained in sync with the rest of the province.
I can see why people might say, hey, if we've dodged this bullet, why don't we open things up? But I guess there's a few things I'd say about it. The first is that we're, as I've heard people say, we're not in the seventh inning of this game. We're at the first inning. First batter is still up. There's still the majority of the population, over 99%, is still susceptible.
Some Thunder Bay area business owners are getting ready to allow customers into their stores for the first time in several weeks. The province is easing restrictions on retail outlets in coming days. Ryan Bonazzo has local reaction.
David Green is ready to take a step back toward normalcy. For the past number of weeks, Mayor Hardware on Algoma Street has only been able to serve customers outside. But starting on Saturday, his patrons will finally be allowed back in the store.
It certainly is a relief. Walking in and out of the store to carry stuff out to the customers is very labor intensive and honestly exhausting.
But it won't be totally back to normal. Due to the narrow aisles inside the 100-plus-year-old business, customers will only be allowed in a few at a time, and they'll have to stay up near the register.
We block off the aisles and we bring everything up to the customer so they're comfortable in the store. It's a lot less running for us.
Garden centers and nurseries across the province have been given the green light to open Friday morning. But some in Thunder Bay, like Creekside Nursery, are open already, having been deemed an essential service by the local health unit. The business has restricted the number of customers inside, widened its aisles to allow physical distancing, and is providing hand sanitizer upon arrival. President Sean Trevisanuto believes Creekside has been able to help its customers cope during this stressful time.
Being in the garden center and being around the flowers and nature, it's definitely helped, and I think a lot of customers are happy that we're open because they want to get in their gardens.
Other retail businesses with a street entrance will be able to open for curbside pickup and delivery on Monday. Chamber of Commerce President Charla Robinson says it's good news for the local economy.
Small businesses compose about 85% of our community workforce. And so the more we can get these small businesses operating at some level, the more we can get people back to work, the more business owners will have the, the surety that they're going to hopefully be able to make it through this.
Ryan Benazzo, TBT News.
There is some troubling news for Thunder Bay's Bombardier plant. The Toronto Transit Commission says it's had to delay any decisions about new streetcar orders. Bombardier wants to build more vehicles for Toronto, but the COVID-19 pandemic has caused ridership there to drop by 85%. As a result, transit revenues are down by about $20 million every week. TTC spokesperson Stuart Green says the pandemic has thrown their longer-term capital planning for a loop, and he's not sure how that will impact a capital project review that's currently underway. For the past year, local union leaders and the company have been lobbying the commission to expedite an order for more streetcars from the Thunder Bay plant. The TTC previously identified a need for at least 60 cars because of congestion building in the system. Financing isn't fully in place. Union officials are worried that any more delays in purchasing the streetcars could put the plant at risk of being closed by 2021. Ontario Provincial Police in Rainy River have one person in custody following a shooting incident that took place today. That was this morning at the Rainy River Health Centre. There is no word how many shots were fired, but the OPP say nobody was injured. Officials with Riverside Healthcare, which operates the centre in Rainy River, confirmed the incident took place in the parking lot of the facility and that no staff were involved. As a result, additional security measures were implemented at all Riverside properties, but no lockdown was initiated. The OPP have released no further details regarding the suspect or what charges they are facing. The investigation continues. And we now know the name of the victim in a fatal train collision in Kenora. The deceased has been identified as 18-year-old Tyrese Payash from Kenora. Officers from the OPP and the CP Rail Police reported to the Norman area of the city around 5 o'clock yesterday morning after a report of a person being struck by a train. EMS arrived on scene shortly thereafter and confirmed that the person was dead. The investigation is continuing, and anyone with information is asked to contact Kenora OPP. The LCBO is extending its hours at over 360 locations province-wide, including here in Thunder Bay. Starting next Thursday, participating stores will be open from 10 a.m. to 9 p.m. Tuesday through Saturday. Most stores will continue to operate from 11 a.m. to 6 p.m. on Sundays, with all stores closed on Monday. The LCBO says the extended hours will help to remove the potential of in-store congestion. And after back-to-back successful hamper handouts at the CLE grounds, the Regional Food Bank and the Salvation Army have decided to stick with the same process. The two organizations have announced 2 more dates for hamper handouts, one on May 15th, the other May 29th. Previous efforts, April 17th and May 1st, saw over 2,000 recipients combined. The two organizations have decided that their drive-through system is the best way to meet the ever-growing demand while keeping staff and customers properly distanced and safe. RFDA Executive Director Volker Krom says the decision to maintain the status quo was an easy one.
Well, we did 2 successful events, and each time we learned something more. We got better and more efficient. And at that time, now it's time to go back to our membership. All the food banks that are closed, that normally carry the ball, we have to consult with them and see how are they ready to go back, how do they feel about the centralized food bank. And overwhelmingly the consensus is that still is the safest route to go because of the exposure to both their volunteers, their staff, and the clients who come to receive food from us.
Krom says the next 2 hamper handouts will run from 10 in the morning till 1 in the afternoon, and he's pleading for everyone to not show up right at the start of the day so that volunteers and staff working the event won't be overwhelmed.
Really a great amount of work for those events.